nurses.
Juliana. Taylor. Ashley. Bryn.
Megan.
And Gabby.
Today we will be learning about how to get a smoking hot bod and promote musculoskeletal health.
Not only to look good, but to feel good.
Let's get started. It's important to stretch before exercising, so let's warm up with some range of motion with our student nurse, Taylor.
All right, ladies, let's do some range of motion. Flexion, extension. Flexion, extension. Flexion, extension. All right, let's use our legs. Abduction, adduction. Abduction, adduction. Abduction, adduction. Okay, are you ready for the feet? Inversion, eversion. Inversion, eversion. Inversion, eversion. Good job, ladies!
Okay, ladies, let's get started. Legs. Woo. Oh. What's the damage?
Looks like she popped it a little too hard. I think I sprained my ankle.
Oh, I think you might have strained it.
Let's go look.
Oh no, I think you might have strained it because you pulled a muscle instead of a ligament. So we gotta remember the acronym PRICE. P is to protect it, so we don't want to do anything to it. R is resting, so we gotta put it down. Don't touch it, don't put any pressure on it, okay?
Okay.
I is for icing the area.
Ice! We need ice!
Okay, so we're gonna put it right here. Is that feeling a little bit better?
Yeah.
Okay, C, we're gonna compress it. We need a compressor.
Press them.
Okay, so it's compressed a little bit, so that'll help. And E is to elevate your leg.
Chair.
Wow.
Okay.
Thanks,
Don't,
student nurse.
yeah, you're good. You're gonna be good. You're gonna be okay.
Job well done, ladies.
Yeah. Hey guys, I brought my grandma to class today.
I just love being with you young, beautiful girls.
Oh, great. All right, let's get back into it. Come on, follow us. Okay, ladies, let's start with some squats. Okay, let's do our right leg. 1, 2. Let's do the other one. 1, 2. All right. How's everyone doing?
No, wait.
What's wrong?
It's my back. These my bones.
Oh, have a seat. What seems to be wrong?
My bones just hurt so bad.
You might have osteoporosis.
Let's talk about some risk factors. Women are more at risk for osteoporosis, especially with old age. If you're greater than 50, you should start screening above 65 for sure if you don't have a family history of osteoporosis. Menopause earlier than 45, you should get checked. If you have less sun exposure, especially in the winter time, you're going to get less vitamin D, which means that there's less calcium absorbed, which could lead to less bone density. Race is white Asians, you're more at risk, and low body weight or broken bones, you can have a greater risk for osteoporosis.
And have you had any children?
Yeah, I had 14.
Wow.
Okay.
You're good.
Well, ladies, how can I prevent osteoporosis?
We've got some good ideas for you. Make sure that you're working out 4 times a week for at least 40 minutes, and make sure you're doing weight-bearing activities.
We recommend you don't smoke.
We also recommend limiting alcohol and caffeine consumption, and since you're a woman, that's 1 drink a day, which is 1 beer.
Also, 6 to 9 servings of fruits and vegetables a day.
And remember to maintain a good and healthy BMI, 18.5 to 24.9.
And lastly, remember to take enough calcium and vitamin D. For ages 14 to 18, that's about 1,300 milligrams per day. For 19 to 50-year-olds, that's 1,000 milligrams per day. Vitamin D, you want about 600 units for ages 1 to 70, and 800 units for ages greater than 71. All right, now let's talk about some good sources of calcium and vitamin D.
Go for it.
Some good sources of calcium are hummus, fortified cereal, almonds, almond milk, tuna, oranges, and lettuce and kale. not forget how to prevent osteoarthritis too. You want to avoid obesity, we mentioned the healthy BMI, and keep being active. That's right. And then you can heat and ice when you're feeling pain. And then make sure you take all the proper meds that your doctors prescribe to you. And then the best thing is early intervention. Go see your doctor if you feel things to prevent a chronic problem. And you're set.
All right, ladies, now we're going to talk about some other back pain sources besides osteoporosis. Some common postural abnormalities include kyphosis, lordosis, and scoliosis. Kyphosis, or hunchback, is abnormal curvature of the thoracic spine. This postural abnormality is common in older adults. Lordosis, called swayback, is abnormal curvature of the lumbar spine. This can be common in pregnancy. And scoliosis. This is lateral curvature of the spine that can make the spine look like a C or like an S. It is possible to have kyphosis and scoliosis at the same time, and this is called kyphoscoliosis. Some nursing interventions for lower back pain with osteoporosis or any of these abnormalities include bed rest, 1 to 2 days at most. You can try over-the-counter NSAIDs, which include ibuprofen and Advil, and exercise only if your physician advises it. And if pain persists beyond 2 days, you should contact your physician.
Some things you can do to prevent lower back pain are, first, you want to sleep on a firm surface on your side.
Wear comfortable, low-heeled shoes.
Don't lift things that are too heavy for you.
You should also lift with your knees and suck in your gut when you lift up things.
You should keep your head down and in line with your back when you lift things.
Don't twist your back when you lift things.
Maintain proper nutrition by having enough vitamin C, phosphorus, and vitamin D. Okay, ladies, let's wrap it up.
Don't forget, you guys, when you go home to wear your seatbelt, wear your helmets, and also wear protective pads if you're riding bikes or skateboarding.
I'll tell you what I want, what I really, really want. So tell me what you want, what you really, really want. I wanna really, really, really wanna zig a zig.
Acronym PRICE, okay? So P means to protective. Okay.
Are you ready? Okay. All right, ladies, let's do some range of motion. Was it range of motion?
Yeah.
Okay.
That's right.
All right.
Wear comfortable, low-heeled shoes.
Remember not to lift things up. Oh, frig!